Thank you very much, and it's great to be here. And as I think that it's been really a good panel this morning, and I think that they had so many good points. And one of the great points was that this is a global conference. I mean, digital health is always global, and so you should see me now in my 5 minutes. This is an example of an innovation agency, and what I will show you is just some of my thoughts of the examples that we are seeing and that we want to see. And so, and one of the really big star tracks that I think that can be and revolutionize this business is actually a company like TrialB, and that's why I wanted Melissa Tran to come with me here today on stage and just really to showcase what could the future actually look like. And it's not the future; it's actually they're really, really boosting today. So, what do we do for future health from an innovation agency perspective? I'm sorry, I'm pushing the next. It's done, thank you. So everything that we do in health is going to be digital health. And I think that many companies have not really realized that. And maybe also the professions have not really realized that yet. But it's really about to happen. When we talked about this 3 years ago, and it's actually only 3 years ago when we really started talking about digital health. We were really looking for what are the great examples of digital health. Now we're seeing that it's everything. And I think that one of the main messages that I always want to send is also for biotech companies and for really the medtech companies that are boosting today to really grasp this opportunity. Because of the companies that we're seeing and in all the solutions and projects, heavily involving also the public sector, we see that the really successful ones are the ones that are user-driven. So, and here I also agree with the patient comment this morning, is that when it's really successful, the patients are on board, and they're on board, and they really want this. We, as the society, really want this. I mean, it's digital health is basically democracy. And from the innovation agency perspective, it's in this sense, it's quite a little money. It's only 2 billion kronor per year that we fund collaboration with. But 2 billion kronor per year is also a really large sum of money, and we can really make a change. And because everything that we do really catalyzes change. And I just want to pinpoint some examples on here. And if you could have read this, you would see that a lot of this money, of course, goes to organizations like the healthcare providers, like the private companies, but they in many cases, of course, these also enroll the patients and the users on board. So what we do when we say that we do investments and in research and innovation, but what we do is we give grants and we invest in our future. On top, we have new initiatives where we are, for example, supporting new types of reimbursement models. So we have some few pilots on that, but it's really interesting, and that's also to showcase what can you do to make a change. But in order to make a change, there's some key actors and that has specific need to boost their innovation capacity. Of course, it's the university and their role in society, but moreover, it's the public sector. And for the last 3 years, we also worked a lot more with involvement and to boost the innovation capacity in the public sector with test beds, but also with high involvements in the different projects and programs. And we have substantial support to the SMEs that are really game changers in this. But it was last year, and I was really curious about what are the growing companies that we will see on the sky 5 years from now. And at the same time, there was a group in Innovation Skåne, and they came up with a pilot action, and we actually supported it in order to see, well, what are the really star companies, and you can't foresee the future, but where do we see it happening? and they call it the Nordic Star Track. And actually, the Trial B company is one of these companies that could actually be one of the companies that we see for the future. And I think that that was only actually last year, and that has really, really been growing. And they have over 35 companies on their sort of pinpointed list now. That is something for the future. But the examples that I want to show first are more on collaboration projects where we have really seen some change happening. So collaboration for future change, we have since some time ago, I think it's 5 years now, really worked on challenge-driven innovation, supporting challenge-driven innovation in projects like, for example, to optimize workflow for digital pathology. And that has not been doing new research, that has really been utilizing the knowledge from research, but also from patients and others involved. This is another example of the patient journey. Also, of course, in enrolling me as a patient, but also the counties and the regions and the universities, and where we can really see a change in utilizing the new information system. And when we started this program 5 years ago, these were some forefront of the projects that we could see nowadays. And we at Vinnova annually we get 4,000 applications for projects, and this is what we see now. We see so many of these projects and actually wanting to do new implementation in our healthcare system. But that's just the key. We see, and we have invested in many interesting projects. Now we really want to make this to the next level and see how can we have a broad implementation of the information society also in our collaboration with the public and private sector. So as an innovation agency, how do you do it? How do you really adapt for the future? How can we set up programs and support new missions from the innovations agency perspective? What we decided is, in order to meet the global competition and really to boost the strong areas that we have in the Nordics, it has to be, of course, cross-border collaboration. And I think that digital health is the perfect example of cross-border collaboration with the really game changes from the game business and the IT, as we always see, together with the patients and the and also with the public sector, of course, in that. And what we have, when we start our funding programs for the future, we now let the stakeholders set the agenda that they think needs to be met in order to seize the future, in order to mobilize the resources of knowledge. So it's in the programs that we are launching now, and we have 16 strategic innovation programs, it's the stakeholders that are on the boards and setting the agenda. But the open calls, of course, will be made from the innovation agency sides, so that it will be transparent and that we can help that boost new innovation. And 2 of the programs that are actually within health are programs SweLife and MedTech for Health. And this is actually a funding body of almost 100 million kronor per year to build future health innovation. And it's all the stakeholders are on board on this. But one of the new missions, of course, that they have is that how can that this also help and boost the transformation to value-based care, where we have the patient in the center and to seize the future. And we have a new governmental commission working on digital health, and we will, for the next year, really support the change to a connected information system where everything connects from the registers and the patient information and the health data. And we've been doing that and talking about that for the last 15 years in Sweden. And now is really the tipping point when I really do believe that this is going to happen. So that's very much about thinking differently and doing differently. And with that, I want to hand it over to you, Melissa, for as a person and as a company who's really been doing it, thinking differently. Thank you.